Hello, this is Dr. Eldred Taylor, and we're here with another interview with one of our speakers, Dr. Martin Kwok. He will be speaking at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia on November the 10th through the 12th, 2016. Dr. Martin Kwok completed his Bachelor of Science degree from the University of British Columbia. Then he went on to receive his Doctor of Naturopathic Medicine and Master of Science of Acupuncture and Oriental Medicine from Bastyr University. Dr. Kwok holds a naturopathic physician license and a Doctor of Traditional Chinese Medicine license. Dr. Kwok's area of expertise focuses on hypercoagulation conditions, cardiovascular conditions, cancer care, and hyperthyroid issues. He is on the board of directors and secretary of National Traditional Chinese Medicine. Dr. Kwok has also served as board of director from British Columbia Naturopathic Association and the Osteoporosis Society of British Columbia. In November, Dr. Kwok will be speaking on the subject hypercoagulation, the missing link in the treatment of chronic illness. Dr. Kwok, how are you doing today?
Hi, how are you doing, Dr. Taylor?
Oh, great, great. So we're excited about having you come and speak to us. And if you would give us a little introduction, a little enticement about the subject matter that will cause our prospective attendees to want to come in November.
Well, the topic I'll be speaking on basically is the connection between hypercoagulation and many of the chronic illnesses that we see clinically. Hypercoagulation often, I feel it's an area that sometimes it's often overlooked. Often, as a functional medicine practitioners, people would look into, areas like hormones. They might look at other functional areas, but coagulation, it's also another functional area that demands balance. Either too much or too little of the as far as the coagulation activation will cause problem. So in clinically, what often we see is in chronic conditions, you often see the presence of hypercoagulation. And if you do not treat it, hypercoagulation actually could lead to either deterioration of the function or the organ function you're trying to treat, try to correct, or you lead to complications. So we think it's important, and sometimes if we can incorporate that into part of our clinical consideration, I think it will definitely improve the outcome of the treatment. For example, one of the often, lot of functional doctors would often use hormone type of treatment, the bioidentical hormone treatment. And we know in terms of hormones, when you use hormones, certain, especially in the Caucasian type of population, statistically probably about 20 to 30% of people will carry what we consider as a genetic coagulation protein defect, which could potentially make them prone to have more coagulation type of issues or thromboembolism type of issues down the road. So in those people, it would be great to have a baseline and before the initiation of hormone treatment, and down the road have a follow-up, make sure at least the hormone treatment has not negatively impacted the coagulation balance. So fundamentally, what we're looking at is the balance of the coagulation. Too much, you get in trouble, thromboembolism issue, and too little, people could bleed. And but nowadays, in chronic conditions, mostly what we look at is the hypercoagulation issue. In the extreme case, that's it can lead to a thromboembolism. So that's basically what we're talking about.
So, do you suggest that we screen with factors more frequently?
Actually, no. What I meant by it is not more clotting factors. But last time, when you look at clotting factor, that's usually in people that there's just more deficiency type of issues. But in clinically during the talk, that what we're going to talk about, there are certain markers that would be an indication of activation of a coagulation system, or hyperactivation. So we're looking more from a functional sense. So instead of looking at a single parameters, what we're looking at is more the behavior of your coagulation system. Similar to, for example, when people do an EKG, it's a functional test. It's looking at your electrical signal, electrical activity of the heart as it beats. So when we look at the heart, the coagulation system, the other way to look at it is look at the function. So the function, it comprises both the activation and also the control. And if you get into more details, even the controls of the control. So that's actually, during the lecture, that's what we're going to be talking about, how to identify people who may have a hyperactivation of the coagulation system, or on the other hand, maybe they have a problem with resolving, for example, what we call hypofibrolytic issue. So they have a problem with breaking down fibrins. So that will be the focus instead of looking at the coagulation factors.
Dr. Kwok, this is kind of a new area for me. When we think of hypercoagulation, we're thinking about thromboembolism. I'm sure there are other tests that you may introduce us to that may give us a hint of the person who might be susceptible without us having to wait till the end point to figure out that they're susceptible. Is that correct?
It is correct. Clinically often, mostly commonly used tests often, doctors will order is like prothrombin time PT, INR, APTT type of test. Those can be sometimes a useful screening tools, but there are also other type of coagulation parameters that when you suspect the patient might have an issue, that actually would help you really get a better sense whether the patient that you're dealing with is a high-risk patient or actually you have a little bit more time. So there are definitely other tests that will be helpful, in clinically help discerning those patients, and it'll give you a degree as far how hypercoagulable the patients are. So it's not just of course the extreme case is when people throw clots, have some kind of thromboembolism, and that's what we're trying to prevent. But even before they get to that stage, if the coagulation system is always in a hypercoagulable blood state, it's actually going to impact the cell function, the organ function. So that's the part actually we're gonna get into.
Right, and then there's treatments for people who are hypercoagulable.
That's right. So what we will talk about during the lecture is not just the commonly used anticoagulants that a lot of doctors are familiar with, both including the older generation ones and the newer anticoagulants. And we're also gonna get into as far as more the non-pharmaceutical type approach, some of the natural approaches. So
Right.
those are the options that in certain areas that actually they would probably do better. Sometimes can actually complement the pharmaceutical approach.
Well, great. Well, again, this is an interesting topic. It's something that we don't, as a functional medicine doctor, you don't necessarily think about as being a significant part of chronic illness. But that's what I love about functional medicine. It broadens your horizons so widely. It's so many areas you have to consider, and I think that's what makes this exciting. It's not the same thing. The body is such a marvelous organ. Uh, Even when you're doing functional medicine, you have to have a broad scope in order to understand how all of this works together. So, very interesting topic. We look forward to having you come in November and give us some more details about what you're going to speak about. But we're very excited about having you.
Yeah, I look forward to speaking at the AFMA meeting, and every time when I'm there, I always learn new things too. That's as you said, functional medicine is it's an endless learning process.
It is.
So
It
we're
is.
all learning. Yes.
Exactly. Okay, Dr. Kwok, thank you so much for your time this afternoon. We appreciate it so much, and we look forward to seeing you in November.